Hello, I'm Dr. Ryan Madnick, an assistant professor of medicine at the UNC School of Medicine in Chapel Hill, North Carolina, at the Center for Esophageal Diseases and Swallowing. This video presentation will discuss our study on therapy versus off-therapy testing in patients with symptoms of refractory gastroesophageal reflux disease, a cost-utility analysis. The impetus for this research stems from the ongoing debate regarding the optimal diagnostic strategy for patients with symptoms of refractory gastroesophageal reflux disease, or GERD, despite therapy with high doses of proton pump inhibitors, or PPIs. PPIs suppress esophageal acid exposure in over 90% of patients with GERD, with similar rates of healing of esophagitis. However, most data show that approximately 30 to 50% of patients on PPIs report persistent symptoms even on twice-daily therapy because of persistent acid reflux, persistent non-acid or weakly acidic reflux, or another diagnosis, such as functional heartburn. Traditionally, reflux testing with pH monitoring has been performed off therapy to make or refute a diagnosis of GERD. The advent of pH impedance testing has allowed for the detection of non-acid reflux even while patients with refractory symptoms remain on their PPIs. However, experts debate whether testing this group of patients should occur on or off therapy. A trial comparing long-term symptom relief in patients who are randomized to one of these two methods of testing is unlikely. To help answer this question and to determine which variables may affect the long-term outcomes, we performed a cost-utility analysis, taking both costs and health-related quality of life into account. We constructed a hybrid decision tree Markov model in a hypothetical cohort of 10,000 patients with typical refractory GERD symptoms despite twice-daily omeprazole, who would go through pH impedance testing on or off PPI therapy. Patients could then undergo either fundoplication or continued medical therapy. Patients who remained on medical therapy would do so throughout the remainder of the model. Patients who went to fundoplication would become symptom-free or remain symptomatic and return to PPI therapy. To try to replicate the natural history after fundoplication, patient symptoms could also return over time. Patients could also develop postoperative dysphagia during the first year, which we assumed would improve with a single dilation session. We then calculated the costs incurred and the quality-adjusted life years gained to determine the incremental cost-effectiveness ratio of testing on versus off therapy. In our base case analysis, we found that testing on therapy cost less and yielded a larger number of quality-adjusted life years per person over a 10-year time horizon than testing off therapy. This result indicates that the strategy of testing on therapy dominates a strategy of testing off therapy under the assumptions of this model. We subsequently performed sensitivity analyses to identify factors that could affect these results. We found that the key variable that could make testing off therapy a preferred strategy was the response to surgery among patients who were tested on therapy and had non-acid reflux. If the initial response to surgery were to decline below 50%, then testing off therapy would become the dominant strategy. There are some important issues to understand with this study. Although we assumed patients with abnormal studies underwent surgery and those with negative studies did not, the decisions of patients and physicians are highly variable. As we learn more about the actions taken as a result of the pH impedance studies and the results of therapy, we may be able to further clarify the parameters used in this model. We also considered only those patients with typical GERD symptoms, and many patients who seek the attention of gastroenterologists for refractory symptoms have atypical symptoms, such as cough and throat clearing. We also did not consider the use of antidepressants in this model, as there are little quantitative data to inform the parameters in this model. In summary, based on this cost-utility analysis, we find that testing on therapy is the preferred strategy for investigating patients with refractory GERD symptoms. Thank you for your interest in our group's research, and we look forward to answering your questions in Chicago at DDW.